Chronic rhinosinusitis, or CRS, is a persistent inflammation of the nasal cavity and the paranasal sinuses. While the causes of CRS vary, ranging from viral infections to systemic conditions like cystic fibrosis, mucosal inflammation often leads to sinus obstruction, secretion stasis, and bacterial infection. Treatments depend on the underlying cause. For example, bacterial CRS may respond to antibiotics and nasal steroid sprays, while structural obstructions often require surgery. Laryngopharyngeal reflux, or LPR, occurs when gastric acid reaches the larynx, pharynx, or even the nasopharynx. LPR results from a breakdown in the barriers to reflux, especially the upper esophageal sphincter. Contributing factors include general anesthesia, smoking, and diet. The squamous epithelium in the throat lacks the protective mechanisms of the esophagus, making it highly vulnerable to acid injury. LPR has been implicated in refractory CRS. The proposed mechanisms include: first, nasopharyngeal reflux, where acid causes mucosal inflammation and impairs clearance. Second, a vagus nerve reflex, which triggers laryngospasm in response to acid exposure. And third, the potential role of Helicobacter pylori, found in sinus polyp tissue during surgery. Diagnosis often involves pH monitoring, the gold standard for detecting LPR. While there's consensus that a pH below 4 is abnormal in the esophagus, it remains debated in the nasopharynx, as pepsin remains active up to a pH of 5. New technologies like wireless pH probes offer longer monitoring with less discomfort, but they may not always be applicable for LPR evaluation.